Hi, I'm James, a knee, foot and ankle specialist, and today I'm going to talk you through the best shoes for accessory navicular syndrome. Please remember, all information in this video is for educational purposes only and shouldn't substitute medical advice. So the three shoes that we're going to talk about in this video are the Asics Gel Kayano 30, the Brooks Adrenaline GTS 23, and the New Balance 860 V13. So the first thing that we're going to talk about is the cushioning in each type of shoe. So in the Gel Kayano 30 we've got a plush type of cushioning, which means that as you apply pressure to it you tend to sink into it a little bit more. What's helpful with this shoe is that it's got a medial posting on the inside, so it's got a small medial posting which puts a little bit of support underneath the medial arch of the foot. That's helpful because it helps to lift the navicular, takes the pressure and the tension off the posterior tibial tendon that attaches onto it, and helps to support the foot throughout the gait cycle. The Adrenaline does this in a different way. It has a guide rail system, so on the undersurface of the shoe it has rails that help to control the motion of the foot from side to side. We know that if someone struggles to control pronation moments throughout the gait cycle, it can put excess pressure on the inner aspect of the foot. In a normal foot, that's not a problem. However, in a painful Os Naviculare or Accessory Navicular Syndrome, it can place extra stress on the navicular and on the attachment site of the posterior tibial tendon. By using the guide rail, it helps to give extra stability to this. In terms of the stability and cushioning in the New Balance, it's a bit more of a responsive shoe. So what that means is when you apply pressure to it, it gives you a little bit of a spring back, as opposed to something like the plush cushioning in the Gel Kayano, which allows you to sink into it. It has a medial posting as well, so this helps support the medial arch of the foot and offload that navicular. In terms of heel drop, that's also an important factor. So we chose these three shoes because they have a high heel drop, and that refers to the difference from the back to the front of the shoe. In the Adrenaline, it has the highest heel drop of the three shoes, so that's a difference of 12 mils from the back to the front. It gives you that nice tilt that helps to shorten the tendon attachments onto the navicular, and it can help offload your pain. In the other two shoes, the Kayano and the New Balance, has a 10 mil heel drop, so not quite as much as the Adrenaline, but what you sacrifice is a slightly heavier shoe in the Adrenaline instead. It's a bit more of a balanced shoe in terms of cushioning, whereas this is more plush and the New Balance is more responsive. In terms of thinking about what shoe might work best for your symptoms, if you have a severe case of accessory navicular syndrome, then we often recommend the Gel Kayano 30 as our go-to shoe, as it tends to have the most medial support, so that's the most support under the arch of the foot. An all-round shoe for walking and running is the New Balance, and a slightly heavier but supportive shoe is the Adrenaline GTS. All the shoes that we discussed are in the description below. If you have any questions about them, please leave them in the comment section. And if you found the video helpful, please like and subscribe to the channel.